Mhm.
Welcome to the Conscious Giver podcast. I'm Tysis Jackson, your Conscious Giver in Chief. I'm so excited to continue our conversation about our Conscious Giving Guide 2021. As I shared with you in previous podcast episodes, if you didn't see it, go back. We have changed the Giving Guide a little bit this year. It's actually still the spirit; it's all the same. But I had an exceptional year. And when I say exceptional, it was presented with challenges and some beautiful moments in my life. But my mom was diagnosed with stage 4 pancreatic cancer, and she passed away in September. And it was it really embodied what our theme is this year is conscious giving every single day. And from the beginning of February through her passing, every single day I had to make a conscious decision to be able to give in ways that sometimes exceeded my energy, my mental strength, but it was a beautiful experience and a wonderful time that I'll never forget. And there were so many pieces that came about from this experience. And so I kind of get to share this and just kind of share what my blessings were from it. And one was my friends. My friends were amazing. There were two of my friends who called me every single day. They don't even know each other, but I felt like they called each other and they kind of called each other and said, "You call her this day, I'll call her that day." But they had me covered. And so many wonderful friends that were close and some who I didn't even see that often just reached out and touched me in beautiful ways. And one of my ways that I'm very grateful is that I was able to meet our our guest today on the podcast. Stephanie Weinrich is an amazing, beautiful person, and she is a native Californian. I'll give you the data, the little demographics before we get to the really good and heart of it all. But she's a native Californian, so you have to remember she's a California girl, which I absolutely love. And she also is a USC graduate and a West Virginia University College of Law graduate as well, where I told her, I was like, I didn't know you were just such a smarty. She was on law, member of law review, second in her class, just amazing things. And she came to DC to practice law, and she specializes in environmental litigation. But so we have these demographics, but what we share, and which has tied us together, is that our mothers were both sick together at the same time and literally passed within 10 days of each other. And then the overriding that we're really going to dig into today is that we both had just really tough challenges with with the healthcare system. And also we were both in rural America. And that experience has really made us think differently about healthcare and how our lives changed our entire lives. So I just want to welcome you, Stephanie. Thank you for being here on the podcast and our actually video. So we're also doing video today. So welcome.
Thank you, Tysis. And I already grabbed a tissue to have on hand because I thought that I was going to be able to hold it together emotionally. And I've already, just in your introduction, I already started to feel the emotions creep up. So I'm ready. I'm ready with you.
You are doing better than me because for some reason, I should have learned from the previous one, and I did not, to have tissue ready because I sort of knew. I sort of knew that this was going to be really tough for us. So I, devoted a podcast session talking about my mom and the wonderful experience and the person she is. And she really was the person who taught me conscious giving and about just always giving to others. And so before I wanted to kind of set the stage to talk about the experience, but I would love to learn a little bit more about your mom because people, I guess, I used to always say to friends that lost a parent is that, you had the most beautiful thing about it all is that you have these wonderful memories. And I didn't really necessarily say it from a place of, I had that experience, so I know, but I just always felt like that was so meaningful. And so I wanted to start there because, you know, just I just know automatically she had such an impact on your life. And the way that you cared for her, I was like, I know she's a beautiful person. So
Well, thank you. Thank you for saying that. I will say my mom, Marcia Bonnet, was just a force of nature. And anyone who met her or knew her for a period of time would wholeheartedly agree. This woman epitomized strength and courage and did it with grace. So I'll give you some background on her because like you said, I think it really sets the stage for the story about conscious giving. So she's from Pittsburgh, Pennsylvania originally. And she grew up actually just a couple blocks over from where my dad lived. They went to junior high and high school together. And in fact, over Thanksgiving, I didn't know this story, but my dad told me that he used to stand on a particular street every morning and knew that my Nana was giving my mom a ride to school. And so he would stand there and my Nana would pick him up. So they grew up together in a lot of ways. And my mother was a very supportive Navy wife. My dad was an officer in the Navy, and for lots of parts of my life and my brother, I have an older brother, my mom was effectively a single parent.
right.
And she took on that role with an intense protectiveness, and she was very fierce. Grew up in a small town in California, Coronado, California, which is a Navy town. And the community there is very tight knit. And my mom, for my generation and my peers, was kind of the community mom. So when she passed away, I was blown away, like, you were, with the outpouring of support that I got from people that I had not heard from in 30 years.
Wow.
Just commenting on, Marcia Bonnet was a legend, and she really was and is, and it lived, she lives on. So her health issues, there's a couple different kind of phases of health issues that my mom unfortunately suffered from, that were just, I'll be honest, just really odd sort of medical issues that are obscure and not sort of this, I don't want to call cancer standard in any way, but I think we are so conditioned now to be familiar with cancer that to me, a cancer diagnosis is probably less surprising than, some of the conditions she suffered from. So When she was 58, she twisted her foot. She worked at the kindergarten. There was one kindergarten in the town I grew up in. She twisted her foot on the lawn, and she broke her fifth metatarsal bone in her foot. And she went to an orthopedist who put her in a walking cast. And as a result of her being in a walking cast, she developed deep vein thrombosis, and very, very severely. And one morning, she was walking to the car to go to school, and she just collapsed before she got to the car. And so by the time my brother notified me, he's still living in San Diego, and the word that I got, and that my dad got at the time too, was that she had, massive pulmonary emboli, and it was a very critical situation. I was living in LA at the time and just immediately took off and went down to San Diego. So miraculously, she made it through the first 48 hours, and the team in San Diego was able to dissolve the clots. But unfortunately, some of the tissue in the leg where she had the fracture died. And so she had to have an amputation, a below the knee amputation of her left leg. She then, as a result of being on such heavy anticoagulant medication, she suffered a brain hemorrhage. And this all happened in a period of like 10 days. But she recovered from all of that, which is just a testament to how strong my mother is. And I just feel very blessed to share her DNA. So she lived for 20 years after that with a prosthetic, and modified and adapted her life around these, I'll just say, deficiencies at this point. A couple of years, and my parents then moved from California to West Virginia in 2009. And so they've lived there for, a decade or so. As my mom, got older, her mobility started to decrease, especially with the prosthetic. And she developed a condition in her other leg called lymphedema, which is something that it's a chronic condition. There really is no cure for it. It just needs to be maintained, which basically means that your lymphatic system does not function properly, and you're not able to drain the lymphatic fluid that builds up in your body. So you have severe swelling, like in some places it's referred to as elephantitis. So her right leg had very severe lymphedema. And, we're trying to study this because the care that she was getting in West Virginia was focused on maintenance and not, letting the disease progress. But I don't think that the doctors that she was seeing really had a grasp of what this disease was. I mean, it's very obscure. Not a lot of, I think that not a lot of people in the medical.
I was going to say, I'm only familiar because Wendy Williams has.
Yeah, exactly.
And she talked about it on the show and brought people on, and it's exactly what you said. It's not common at all.
No.
And those uncommon pieces are really challenging when you have a very small community. So they were living, which part of West Virginia did they live in?
So in the central part of the state, about an hour south of Morgantown, where the university is and the university hospital is, they lived in a town called Weston, a very small town. I mean, I don't know the population, but just probably a couple thousand, if that.
Yeah.
And the one hospital, and it's a very small hospital. And so as her condition progressed, she was needing more medical care. And most recently in this past summer, in July, she started to have bouts of nausea where she would, vomit every 2 to 3 hours after she ate. And it was not, not to be graphic, but pretty violent vomiting. It wasn't, you just have an upset stomach. And the local doctor there diagnosed her initially with just acid reflux. And, because of her age, she was 78, that he attributed it to just wearing down of the esophagus and so literally prescribed Prilosec. And it continued. Did not order any tests, no diagnostic tests, just said let the Prilosec run its course, which I think it's like a 2-week course before it reaches its effective efficacy. So it did not, this vomiting continued. And I started to get very concerned that she, number one, was going to get dehydrated and then cause a whole bunch of other problems. And number two, that she was just going to be nourished. So I finally convinced my father to take her to the hospital. And there was a reticence on his part, I think, just because this is his wife of 57 years and it's difficult to watch her in this way. So she got to the hospital, was seen by the attending physician at the ER who I don't think was not an MD. It was a DO, a doctor of osteopathy. I think that's what it is.
Osteopath.
Yeah. And she was initially diagnosed with pancreatitis. And our common friend, Wandy, I was keeping in touch with her, and she was asking me for any lab results that I had so that she could, take a look and assess. And so I had done that. And, Wandy told me, well, her enzymes are not elevated. I mean, usually in pancreatitis, you see, I can't remember the name of the specific enzymes, but they're off the charts, and hers were slightly elevated, but not, nothing that would lead to a pancreatitis diagnosis. So she's in the hospital and she has been given an NG tube, which a tube that goes through your nose and into your stomach to essentially pump it out. But she was still even though they were pumping out her stomach, she was still vomiting.
Oh gosh.
The only doctor at this hospital was a general surgeon. And the surgeon told my family that he thought that she should have basically gastric bypass, because her stomach was not functioning. The motility of the stomach had slowed to a point where it wasn't emptying into the small intestine and just going through the GI tract.
Right.
And I said to this surgeon, how have you consulted a gastroenterologist? And he looked at me like he had seen a ghost. And that was when I realized that I had to kind of step out of my role as the really worried daughter, and become an advocate. As I would imagine you had a similar experiences where at these hospitals, these rural hospitals, where it's really only local people who go to these hospitals, the dynamic between the doctor and the local community is one of, they don't question, they don't ask questions. They just accept what I think the doctors say as fact. Instead
And
of,
it's almost like a baby boomer thing too. Like my mom
yes,
always went to the doctor and she didn't push, like she would never push back. And like my mom had polyps removed, and that's why we wasn't sure what the pain was. And similar to your mom, it was like an over the counter like probiotic, and it was a general surgeon was like, just get a probiotic. And my sister and I are like, this makes no sense at all. Like we were like, we couldn't figure it out. But she was also between her primary care, she had a PA, she retired, and we were waiting on the new one. So we were like, we just didn't know what to do because there was no one literally to call. So it's like, what do you, it's like, it's really hard to advocate.
it is hard to advocate. And I think part of it too is just a social dynamic. I think given that I was the advocate in my family, I took on that role. And it's a role that my mother has taken many times for, others. But because I was not a local resident, I don't live in West Virginia. I went to law school there, but I'm not considered a local. Yeah.
Right.
I think that there is some, I don't know how to say this, intimidation. I think that rural communities feel when an outsider comes in and starts asking questions. And I think the doctor that I was dealing with started to feel very undermined by me, which was not my intention. It was just really to have him explain his rationale for suggesting this procedure, because it did not make sense. And that wasn't me saying, I know any better than you do. I didn't go to medical school. I was just asking questions.
Because you wanted to understand, how did you come to this decision?
Yeah. He couldn't, and when he couldn't answer the questions, that's when the light bulb.
Red flag. Yeah.
It was a red flag. It was a red flag.
One of the things that was really tough for me to decipher is because I was in the South, everyone was so nice. So I had to make a decision regardless of saying, okay, being nice does not equal competence. And so I really had to dig in and figure it out. I was fortunate my mom's oncologist literally just arrived 3 months to the area. He's from California. Brilliant. It was amazing experience with him. And that really, but it really made a huge difference. But it was a lot of other pieces going to the local hospital. And it was sort of, you were a little afraid, you were just trying to navigate, okay, who really knows what they're talking about?
And you don't, and you're absolutely right. On a personal level, the care that my mother received, these people my dad put a lot of weight on that and value on that. And I don't want to be dismissive of that sort of like personal real care instead of a cold clinical feel, because that's not what my mom experienced at all. But like you said, you have to be realistic and know that sweetness does not equal competency. And you don't want to be rude and you don't want to offend anybody, but it's our mother's lives that are at stake. And if I offended people, and I know I offended people, I was okay with that if it meant that my mother was going to get the care that she needed.
And it was so hard. I think the other like layer to all of this too is that it was during COVID, and you're just sort of like, like the first time my mom was in the hospital for 3 times. The first time we couldn't even visit her because it was just the numbers were too high, and so they were on a different lockdown protocol, and it was just and she actually, the nurse that brought her out, she's like, I never want to see him again. And I thought, oh my God, what was happening when we couldn't be there? It was. Ooh.
It is. I mean, you're absolutely right. That the fact that, we are in the middle, I don't even know at what point we are in this pandemic, but it definitely added a layer of complexity and difficulty and huge obstacles to navigate through. And it made me, unfortunately, a very bitter person against people who, in my opinion, have been very reckless in how they have been dealing with COVID. When my mother, when the doctor realized, and I think that the doctor came to the conclusion on his own, or at least was just so annoyed with me that he was like, I want to get her out of here. But he said, I think we need to transfer her to a larger hospital, which I had been trying to suggest. She had been in the hospital 10 days at that point, and there had been no change.
And it sounds really complex. Like, this doesn't even sound like an issue that, you're like, oh, right away, you can just, it makes sense. And even I'm not a doctor, so of course it wouldn't all, but it just sounds like it's a very complex issue, complex care. And like, that was one of my regrets, right? Is that my mom, I was like, she's at an age, she had enough issues going on. Her, like, she should have been in a family practice, like, having a medical home that people who knew what was going on. And that's one of my regrets. But I just wasn't, it's different. Like, you and I, we both live in DC, and, it's a whole different story about just, of what I think about the care, how it's not, everywhere isn't perfect, but it's a lot more seamless and a lot more choices. I'm choosing my primary care doctor based on, well, I like them because they do X, Y, Z, or they're a top doc, or, their ratings are high.
Absolutely. And the town my parents live in, there are 2 primary care doctors. So it's,
and they're overwhelmed, I'm sure.
Overwhelmed. I have a lot of sympathy and compassion for these healthcare professionals. Doctors, nurses, administrative staff. They are working so hard and doing the jobs of, 14 people. They're stretched. And I think that our moms suffered as a result of that. I think that had they not been so ill during a pandemic, maybe the outcome would have been different, or at least prolonged. That the fact that my mother had to be on a waiting list for 4 days because all the beds were taken up by unvaccinated COVID patients. It was like very frustrating. She finally got to a hospital in Morgantown, which was a bigger hospital, a lot more resources. But I'm going to be honest, Tyson, it was still very local in my view. West Virginia, I think one of the greatest parts of West Virginia is people who live there and grow up there love their state, and they're devoted to it, and they are loyal. They don't leave. But that also means that people from other parts of the country don't come in. So I think that there's a little bit of kind of tunnel vision that happens, and I think it's impacted the healthcare system there.
Yeah, and it's I was really fortunate. I got to know really wonderful pediatricians and from West Virginia, and it's almost like, you're right. And then it's almost like it's how do I put this in? I'm trying to put it in a very nice way, but you also have this, they're always under this cast of legislation and decisions that elected officials are making as well, that really puts, like when you're talking about resources, in like dire straits, right? Like it's just, hospitals, it's great to have a rural hospital, right? Because they're, hey.
It's necessary. It's necessary in a place where people, it's naturally socially distant. Unlike DC, where, we're climbing on top of one another, West Virginia is a beautiful place where people are very spread out. And there has to be healthcare for those who don't have access to the bigger hospitals, and it's hours away. But at the same time, those, regional local community hospitals just don't have the resources to take on, I think, very complex cases.
And I just, when I hear, I love when you're talking about, because I could relate. Like it was easy to do the caregiving. It was easy every day to do it because I knew like my mom would do this for me. Like, and I like, I just want to measure up of what, just an inkling of what, how she would care for me. But then, the piece of the, advocating for her is just such a common theme. So when you're at this larger hospital, you still are in this place, regardless, you're still in a place where you're having to advocate for your mom. And
absolutely.
Yeah. So tell me a little bit more about, as you're, you arrive at the larger hospital, and it's still the extension of the frustration of like not really getting to the diagnosis.
Yeah. And the diagnosis and a course of action. And, we get to the bigger hospital, and the first doctor she saw who came in was another general surgeon. And he said that she has a condition called gastroparesis, which I think just really means paralysis of the stomach. And he said, I'm going to put a feeding tube in. And I said to this surgeon, and I think everybody can probably agree that surgeons tend to be very, they have a lot of confidence in their abilities.
But then he had
And
not met Stephanie, so he
no. And they do not like to have questions asked of them. And I just said, is there a gastroenterologist on staff here that can evaluate her? And you would have thought that I asked for the moon and the stars above. It's again, I feel like this tunnel vision where they're so used to just doing what they want and not having family members question them, because what do we know? We don't have a medical degree. But I was just looking at it from my mother's stomach isn't working. I don't know why a surgeon is involved at this point. Maybe we'll get to that point, but I would like to have a doctor who specializes in GI issues evaluate her. So she did get a GI consult, which I have to say was this doctor and his nurse practitioner were hands down the most competent, thorough, kind, talked to us in a way that we felt like we had a plan of action. Like we knew
Right.
the next steps were going to be, like we're going to try this medication, and if that medication doesn't work, then we're going to do this and that. And I think that was such a relief to have sort of roadmap laid out for us instead of just being told what's going to happen,
Right.
and having to accept it.
Because in fact, this whole time, your mom is in so much pain. Like
she's in pain. She's in pain. She's, is continuing to vomit. She's like not able to eat. So at that point, she had like intravenous nutrition. And we're talking about like already she's in hospital for like a 2.5 week period. And that weighs on a patient emotionally a lot. So the GI doctor kind of took over, which my family felt comfortable with, and started her on medication. And initially she really responded to it, and was able to have the NG tube removed and started to eat small meals. And people who have gastroparesis, again, which is a very obscure condition that is chronic. It's like I was Googling it, and it's the first thing it says, like there's no cure. It's another condition that you have to manage. But she was able to start eating very small, bland meals like that would not be difficult to digest. And for a 4 or 5 day period, she was progressing, and we were talking about her getting discharged. Then it was a huge step backwards, and the vomiting started again. And the GI doctor said that we had sort of run out of options to avoid a feeding tube, because it was getting to a point where her lack of nutrition could cause even more significant problems in other ways. So the GI doctor recommended placement of a I can't remember the name of the feeding tube, but it was a feeding tube essentially. And she had that put in on a Monday. It was like a local, it wasn't a major surgery. Put that in, and my family, we were rallying and talking with her, like, we can do this. You've been through so much adversity the last 20 years. Like, this is a walk in the park. And Right. I
Yeah,
mean,
it's like you're like, I'm advocate, I'm cheerleader. Like,
cheerleader. Yep. Yep. Yeah, exactly. And, one thing that I kept reminding myself, and I told my mother, because, she was at a point where she just felt so bad. She felt like a burden, to us. I mean, and obviously that was not the case, but she was feeling that emotionally. And I reminded her, and I reminded myself that she spent 47 years. I just outed how old I am. She spent 47 years preparing me for this.
Ooh,
And,
that's good. Okay.
and this is the gift that I give back to her, because she had done it her whole, my whole life.
Right.
So the day after she got the feeding tube was the best day in the hospital. We had a good day. She was like, had a lot of energy. She was able to do PT. We were laughing about, it was like the day after the Met Gala, and, and she was
You're
laughing.
like, what the heck were they wearing?
She was like laughing at what Kim Kardashian wore, that like whole that
Oh,
on,
yeah.
she's like, I can't deal with stupid. I'm like, that's my mother. But so again, we were like, okay, she's gonna get discharged this weekend. And then the next day, I get to the hospital, and she's having some like fluid leaking from the site of the feeding tube. And so the GI doctor comes in and is like, I'm just going to tighten it up a little bit. He did. Next morning we come back, and the fluid, it's even more, and it was leaking, and it wasn't, she didn't have an infection. They couldn't really tell us what the fluid was. They said it could have been bile. And I'm sorry that this is graphic. But the GI doctor sutured more around the site of the feeding tube to keep it closed. And that was Thursday. And I had come back to DC because I thought, I'm going to come back over the weekend to help with when she was discharged. So Friday morning, my aunt calls me, and her and my dad are on the way to the hospital. And I was talking to her, and they were walking into the room, and I could just hear a lot of commotion. And my aunt saying like, oh my God. And then like, I'll call you back. And so I'm just frantic and panicking. And come to find out that my mom had coded. They called, a trauma team to come in because her oxygen levels had just dropped drastically. And so essentially, whatever this fluid was that was leaking, she aspirated on it. It got into her lungs. She developed pneumonia very quickly, like overnight. And she was immediately placed on a ventilator. And for somebody, that was day 29 of her being in the hospital. And, it's never good when somebody's put on a ventilator. It just, we knew, unfortunately, that it was highly unlikely that her lungs would recover from this. So that was Friday. She went into ICU, and really her GI issues became secondary to needing to resolve her breathing. And we were driving. And so when I heard that, I immediately drove to Morgantown and got there, within 3.5 hours. And so my aunt, my dad, and I are driving to their home, which is like an hour plus away from the hospital. And as soon as we are pulling into the driveway, I got a call from the ICU nurse saying to come back, that her oxygen levels had dropped to the 80% level. And that was with it, receiving 100%. So ultimately, my dad, I mean, we did this as a family, but decided to withdraw the ventilator. She was made comfortable, wasn't in pain. And then, within about an hour or so, she passed away.
Yeah.
And I even just recounting all this, and I thank you for letting me just go on and on about this.
Well, actually, like when you're telling the story, I'm like, oh my gosh, this is like, I mean, it really
seems unreal. It seems unreal to me.
And I think the other parts too that you talked about so well is, just in terms of how much it really just affects you, right? So you're going through this experience, and it's a deep, profound experience. I mean, we all wish that we could have the experience where, my mom was a ripe old age and she peacefully went to her sleep, but that it's just not the case.
No. And I have come to realize and accept that loss is a part of life. And it really is a common experience that we all have to deal with in some way. But when you lose a parent, and look, I didn't think that was going to happen. I thought, maybe I have another 15 years or so.
Yeah.
But I physically feel like part of me is missing. And it sounds, people who haven't experienced it, I think it sounds very woo-woo, but I feel like a piece is missing.
Yeah. It's so hard because I just went back for Thanksgiving to see my family, and my mom lived with my sister, her husband, her family, and so and she had her own little suite area on the first floor, and it was it was hard for me. Like, Thanksgiving was not fun, and it wasn't because my mom prepared the food every year. So my whole life, but it was more so I could just feel her spirit there. And it was really difficult to just feel that. And because and I'm sure it's the same with your dad, this is an everyday. So it's not the same for them as is with you. And it was, and this week, I think, I can't remember, there was an actor or something, and pretty much he was just talking about grief is just the love with no place to go.
Yes. I know exactly what you're talking about. Grief is love that, yes, it was Andrew Garfield. Yeah. I had 3 people send it to me. Because it was grief is unexpressed love or something.
Yes, there you go. Yeah.
And it was so, it really captured this sort of intangible feeling that unfortunately we feel. And it Thanksgiving was rough. It definitely was. And it was the anticipation going into it also was I don't know how my dad's going to be. How do I need to be, and at some point I just,
Oh, sorry. We got it.
Oh,
my internet was a little.
That's okay. I'm
It's not a good internet day. I don't know what's going on. But you were saying that you're just just going into Thanksgiving and how you were feeling and just
anticipating, you know, and again, this is the part of what my mother instilled in me is to, I think, you know, care for others and take care of my dad. My mom took care of my dad. You know, one of the things that I did the night before her burial, so she was cremated, and we had a beautiful urn that we put into a vault, and we were able to include mementos or whatever we wanted to.
that was so nice.
And, you know, we each had, you know, different items that we wanted to include, and I chose to write a letter to her. And I took a picture of it so that I could, you know, go back and read it and know that I left those words with her. But, you know, I'll go back and read it. And what just struck me was I just kept writing, like, you taught me, and you know, it was just kind of, I felt like I'm gonna make you proud, like, not,
yeah,
like, let me handle it now, you be at peace.
That was, it's, and that I love that what y'all took with her, with the cremation and sharing that was great. I'm like, that is such a wonderful idea. And because we still haven't figured out like what we wanted to do, and my mom was cremated, but because it's almost like the piece of letting go. And one of the things I remember, so this is, I guess the topic is going to be GI doctors. But when my mom was first diagnosed, I realized in my personality that I was like a fixer, right? So I'm like on my computer Googling like, what is pancreatic cancer? And one of the first things it said was a gastroenterologist. And I'm like, my new neighbor is a guy, you know? And so I like go to her door. I'm like knocking on her door, and her mother is in town and answers the door. And I'm like, oh my God, like, this is like, oh. So, you know, I left a note, and she calls me, and she was the one that she's like, they misdiagnosed your mom. And I'm like, oh my gosh. So I'm going through this period, and then, you know, everyone is sort of lackadaisical. Well, this is from the, you know, my vision about my mom getting in to go see a specialist. And so I sort of started to take charge. I'm like, I'm coming down there, you know, and I just remember at one point I had to say, I can't be angry. Like I have to let this go. I can't keep functioning. Well, you know, some people caught my wrath. There was a few people, and I feel, in a sense, I feel bad because they were in a system like that just like didn't make sense. Like we were talking earlier, it was like this like idea of, we thought that fax machines were obsolete, but then you realize when you're in a medical environment, faxes are king. They are everything. And
unbelievable.
Yeah, there's just like this system that it's like no checks and balances. And, you know, so I'm like literally calling, and, you know, by the kindness of the person who picks up the phone says, oh, I can get her in a little earlier. You know, you're just, you know, it's like you throw in the air. And I made the decision. I was like, God, I'm going to trust you. I'm going to remove this anger, because I can't function like this. Like I can't, you know, I have to come from a place of love. And my mom was still, you know, aware, and she wasn't going I got in trouble one time for being too mean in her presence, but you know, because that's that baby boomer thing, right? And that's really hard to navigate. But
I got in trouble. My dad yelled at me a couple times.
oh, I forgot you had your dad. Oh, yeah.
Oh yeah, yeah. No, he
Yeah.
yelled at me a couple times.
My sister sort of always would give me this look like, "Ooh, you're about to get in trouble." But
Yeah.
but I remember one time there was something that was going on, and I'm at, her oncologist is there, and they're like, "What's going on?" And I was just like, I wish I just had enough money for someone to walk us through this system and just to make it happen. Like, that's all I just wanted. I was so frustrated. I was like, why can't we just make this happen? And then I realized there's just not, it's not about money.
It's not. I mean, that may be a factor, but I agree with you. You throw as much money as you want, and it's still so complicated and bogged down, and
Right.
it's just so frustrating, because I think you and I are the same. We're pretty practical minded people, like problem solving. Like my career, and it sounds like our clients come to us with issues and we solve it for them. And like, why couldn't we do that? Maybe from the medical perspective, but like at least getting the situation to a point where the right person can address.
Right. It's really, it's definitely an overwhelming process. And I always think about, like, as we were talking with Dr. King, and he was saying, if this is my experience, and I'm like, I've worked for health systems before, this is my whole career. How, imagine what it's like for other people. And that's what I always think about too, is, if I'm, I looked around, like, my mom, when she was getting chemotherapy, and, I shared this story before, but there was a young guy that came, and he rode his bike for treatment. Like, you're getting cancer treatments, you can't ride your bike. I mean, but like, and and I'm just like, I don't even know if they have Uber here. Like, can I get them Uber? You're like, I mean, it was just overwhelming.
You spend enough time. My mother was very blessed to have this familial unit that, like, we were not going anywhere. We were not leaving her side. And it was sad to see, a number of patients that were alone.
Yeah.
Because it's very hard, if not impossible, to advocate for yourself when you are ill. You need somebody to do that for you.
Yeah. One of the things that, we got to learn all about your mom, and then this whole process. But one of the things I would love for you to share, just sort of close out, is if there was one thing that you could change, like the magic wand, from learning from this experience with thinking about, like, our healthcare system, because I'm talking about my experience in Georgia, you're talking about West Virginia. What would be that one thing that you would say, if I could just do one thing to make this change, this would be it?
Yeah.
And I'm sorry, it might be really hard, and you can cheat a little bit too.
Well, when you had sent me that question, I was spent some time thinking about it. And I mean, I could come up with a whole laundry list of what I would change. And ultimately where I land, it's not something that just is unique to rural healthcare. I think it applies across the board. And that is, figure out how to incentivize people to become medical professionals, because I think that our healthcare system is it's spread so thin. These people are so overwhelmed. They are working so hard. And when they do that, that's when mistakes happen. That's when things slip through the cracks. That's when the right hand isn't talking to the left hand. And I think if there were more people who shared in the workload, that there could be maybe some more, like personalized care that that can slow down and really look at the patient. One thing I felt was like there was always this frenetic pace because you had to go from one patient to the next patient to the next patient, and you just felt like you were a number. I wish there was a way to increase salaries for nurses and support staff, and just, I think there are a lot of people that want to do good and want to and like to be caregivers, and that's their calling. But if it's not realistic economically, they go to other careers, and I just wish that didn't have so much of an impact on this system.
Yeah, that's such a wonderful point. And even when you think about the pay disparities, when you get to rural parts of the country where you're like, really, this is me,
Yes, absolutely. And the ability to recruit, it's difficult under the best of circumstances, but in the rural communities, I think it's just an insurmountable challenge.
I know. Yeah, I agree. Well, one of the things I wanted to do to change with the Giving Guide this year was to kind of hone down a little bit on our nonprofits and be able to just have a few that sort of embodies what the spirit of what's happening, what we'll be talking about during these podcast episodes. And, I had Dr. Ackland from West Virginia, and then with your mom. And so I share with you that one of the organizations I decided to choose, I actually was, was very deliberate and like digging around and trying to find the right piece. And one of the referred organizations was Think Kids West Virginia. And I thought, it made, I was like, oh, this is so perfect, because I know Dr. Ackland, and, her advocacy for kids is so strong. But then I also wanted something that sort of just, kind of honored your mother as well. But I had no idea that like literally she worked in the education system, and the community and the spirit. It's just it's so perfect.
It's so fitting.
So I just thought that, I just wanted to share with that, that is an organization I just think is really trying to advocate holistically for kids in West Virginia. So I'm excited to be able to support them in the Giving Guide this year, and to keep the spirit of your mom alive through that. So thank you so much, Stephanie.
Thank you so much. I'm like speechless, even though I've been talking nonstop for however long, but our connection and meeting under these circumstances have been such a gift to me, and for you to honor my mom through an organization that I know she would have picked out on her own. It just,
oh my gosh, it's just like divinely situated. I'm like,
that's exactly what I was going to say. I mean, the universe works in crazy ways, and like, it just could not have been a more perfect match.
Well, I will close and say that when our friend, our mutual friend, Wandy connected and told me about you, and she was, I'm sure vice versa, didn't really share until like after the fact. And when she said it, I was like, oh, okay. I'm like, what am I supposed to get out of this? Meeting someone else, because you're in your grief and you're just like, and it's, and
Yeah.
then we haven't been home, right? So we're
Yeah.
just, our lives are like impended, and so you're trying to think about that. And then I started thinking about it, and I was like, oh, this would be so perfect when I was thinking about the giving guide. But I was like, this is a really big ask, because I know like how I feel and my mom. So I really just appreciate your strength and ability to share, because we lost our moms just a few months ago, and we're still working through not only the grief, but just the overall experience of coming out of that. I mean, I said I needed like a month on the island. Just
Yeah, no, I wholeheartedly agree, Tysus, and I think that both of us are a testament to our mothers and what they taught us.
yeah.
And I just I talk to her every day, I feel her every day, and my ability to do that gives me the strength that I need to, get through my life.
Exactly. Well, we are our mother's daughters, and
We are.
and we will make them proud. So
We
thank you
will. We
again.
are.